Good evening, everyone. I'm very glad to be here. Thank you for the organization for invite us to stay here in this moment. So today we're going to talk a little bit about the Oropouche situation in Brazil and other arbovirus that can be emergent and has been re-emergent from Amazon area. So to start our conversation, it's very difficult to separate the arbovirus in Amazon and the history of Evandro Chagas Institute. They are totally connected because the Evandro Chagas is the national reference lab to study arbovirus, diagnose arbovirus in Brazil. And also, along more than 17 years, we have been dedicated our life to surveillance and research studies of arbovirus in Amazon regions. So along our history, we identify more than 200 different kinds of arbovirus along our studies. Most of them include, especially in Togavarida, Flavivirus, Permibunia-virus, Flenovirus, and Rhabdovirus family. But from different kind of animal samples, wild samples, and humans, and also mosquitoes. Every time that have some significant impact in Amazon forest for some human activity, such as highways or hydroelectric is building in the forest, or even have an outbreak, even have the deforestation events in our region, the Evandro Chagas goes to this place and started the investigations to try to detect the virus that can be emergent in case some outbreaks or problems in public health in Brazil. So during all our history, we detected around 40 arbovirus that are linked directly to human disease, human infections, but we can highlight some viruses that are very important because some endemic outbreaks in Amazon, such as Maiaro, chikungunya, mucambo, dengue, Zika, yellow fever, and Oropouche, of course. Along with all these studies that have been done in Brazil, we built an important arbovirus collections, and we have more than 10,000 isolated viruses that now we are starting a collaboration with French, with our colleagues from University of Marseille and Institut Pasteur from Guyana Francesa, that we're going to start to sequence around 3,500 virus from our collection to extend our knowledge about arboviral diversity and evolution in Amazon region. So regarding the flavivirus, we cannot forget the two most important viruses that we have in Brazil. The dengue, of course, because the dengue is our biggest challenge in Brazil. Along the 40 years that we have cycling epidemics occurring each year in our country, just changed the serotype of dengue. And in the last year, in 2024, we faced the biggest outbreak for dengue in Brazil. We have more than 4,000 cases detected in our country. But we cannot forget the yellow fever, But in spite of the fact that Brazilian has the vaccines that are in implementation since 1942, more or less, we still have problem with cases by yellow fever. We have each 3 years, we can see an emergence of yellow fever case in episodic outbreaks and also humans outbreaks. And the virus that have been keeping only in Amazon can spread for other parts of the country, given this kind of problem. Regarding the alpha virus, in Amazon, we have both groups that are circulating eventually in our cities, in our environment. So we have the encephalitis groups that we can detect from animal samples, and also some cases, human case in Amazon, such as mucambo, encephalitis equine complex, and whatever. But for sure, the astrologic group is the most important. We can start talking about the chikungunya that is not come from inside our forest, but was introduced in 2015. And until this time from now, every year we have been seeing the potential of chikungunya and the consequence in our public health situation in Brazil. So we also detect not only the classical cases, but we have been detecting fatality case and also neurologic case by chikungunya. But when you're talking about the virus, the alpha virus that come from, they are keeping in the Amazon region, we cannot forget myariovirus. Myariovirus is related to chikungunya. It also causes astrologic symptoms like chikungunya. And we have seen along the years some outbreaks caused by myariovirus, especially in Amazon region. And it is because we are in Pará state, in the Amazon state, and they were responsible for the diagnosis for the myariid for whole country. Another challenge for us is Oropouche virus for sure. It's a group that we don't have too many information about them, but what we know that we have in our collection at least 15 Oropouche virus that are associated to infections in humans. And we can highlight here some ones that are prevalent in our serological studies, such as Caraparu, Moju, Catu, Guamá, and of course, our Oropouche virus. Oropouche, as everyone knows, causes the Oropouche fever. That is a classical febrile disease, very similar to dengue infection. There is no case too much problem, but we have the main symptoms is fever, muscular pain, and the patient describes a very strong headache that can keep for 3 or to 7 days. So about 50% of the cases of Oropouche infections, they move for a second stage on the patient recover, and after 7 to 15 days, the symptoms comes back, and we have another symptoms situation for the patients. And this moment is very important because the severe case have been seen in this kind of patient that have this recidive case. So Oropouche is maintained in the forest, in the sylvatic cycles, involve birds, no human primates, sloth, and the vector, the arthropods vectors, is not very well understanding in the jungle. However, since the first outbreaks that have been reported in Amazon, the Institute collects some epidemiological data and perform also experimental studies in our labs that indicates that Culicode paraensis is probably the main vector of Oropouche. When this virus also can cause outbreaks in urban areas, and probably Culicode paraensis again is the main vector of this arboviroses. When you see the history of outbreaks caused by Oropouche, we notice that the most of them, it was concentrated in Amazon, but this has happened because the Evandro Chagas is inside the Amazon. And also we have other institutions that dedicate their efforts to study the arbovirology, the arbovirus in the region. The first, like I said, the first biggest, large outbreak in Amazon was reported in 1980s. However, since that, we can see other outbreaks along the history. But at that moment, we noted two things that just now we have more substitution data that support our hypothesis. There was the detection of the virus by isolation from cerebral spinal fluid patients with patients that have neurological manifestations, and also some pregnant that have miscarriage and antepartum at the moment. But now, what we have been seeing since 2023 is the last outbreak case by Oropouche that is starting, of course, in Amazon, especially in Amazon state and Acre, Rondônia. And later on, we could detect in whole countries. And this is just it was possible because the Minister of Health, together with the institutions in Brazil, developed molecular tools that was fabricated by a company in Brazil and distribution for each state in our country. So based on this kit that is now available for whole country, and just to let you know, in the past, all the diagnoses from Oropouche is our responsibility, and they need to send the sample for us to investigate Oropouche. We can see now the explosion outbreak capacity of Oropouche in Brazil. On the 90% of the countries, we can detect the case of Oropouche. Another thing that was important in this outbreak is the molecular study that had been done. So the phylogeny analysis showed that Oropouche has a resourcement between our sample that we isolated in 1960 in Brazil with Iquitos that are detecting in Peru. But if you're looking very close, all the samples, all this data that came from the outbreaks in Brazil, even like the first isolation for Oropouche in 1955 in Trinidad and Tobago, we can see the Oropouche keep the same genome organization, and we just have few mutations that are observed in his genome. But this mutation was enough to enhance the viral replication, and that was being seen even in cell cultures and animal models. Regarding the severe case by Oropouche, like I said, we have been detecting along the history some meningite and encephalite cases associated with Oropouche infections, but it's very few cases. It's not very expressive when we see along the outbreak. But in this outbreak, we have at least 2 events that was very important. First of all, we detect the first fatality case by Oropouche that was detected in the northeast of the country, in Bahia state. And also, we detect the newborns in fetus outcomes case by Oropouche. And what has been seen is we have a larger spectrum of fetal outcomes and pregnancy symptoms too. So we can notice miscarriage, we can notice fetal loss, and with mother that have all the classic symptoms of Oropouche. We have fetal loss without the mother present any kind of symptom, just a very slight headache. We have antepartum, we have microcephalite, but it's not often that have been observed in the Zika outbreak. And also we have symptomatic mothers with all classic symptoms, but the fetus that have any effect, the fetus born and still fine until now at least. So, but another thing that was very important in this moment was when we noted the fetal death, the fetal loss, the magnitude of the damage that Oropouche can cause in the organs of the fetus. We have seen the compromise for all the organs, especially central nervous systems and liver, and also in the vessel systems. So that can be explained why we can see this extensive damage in other organs caused by Oropouche in the death, in the newborn, in the fetus death loss. But this, there was one case that was very interesting because it was the mother that have just a simple headache, and we are following with the other tests during the pregnancy. They was fine, and 5 days later, we detect the fetal loss. The fetus was dead. So just 5 days was enough to Oropouche to cause the damage in the fetus. About microcephaly, we cannot see too many cases in Brazil, but this is expected based on our experimental studies. So what's seen is some microcephaly case that the baby born and still have some problem, but is still alive. But the most of the case, we have the death after a few days after the birth. So when we compare the chikungunya, Zika and Oropouche, what has been seen is, looks like Zika is less virulent than Oropouche when you're talking about the fetus compromising. And this and Oropouche, because they have better replication, we have cases ridge damage in the organs in the fetus. The end of this progress is the fetal loss, is not a microcephaly, as we have been expecting in this outbreak. We know that when we look forward in our expectations, in our perspective of studying in Amazon, we have an Herculean challenge to try to investigate all the possibilities, all the outbreaks and investigations that we need to be done in Amazon. But I'm sure that in this moment that we have important partners, like French partners, that we are talking again to try to restrict the studies, we are able to contribute better with the public health in Brazil and the science in the world. So I'd like to thank the organization, the Evandro Chagas Institute, in the name of my director that's also here, and the Central Labs and field crews, and all the partners from Evandro Chagas for all the efforts that we have that help us to in this work. Thank you very much.
Thank you so much for that interesting presentation. For me, living in Europe, in Romania, first time I heard of Oropouche when was Professor Yazdan presented it last year in Romania, so we have no cases. But now that you nicely presented all the steps, I do believe we are not looking for it. So I think we have a lot of things that we need to do regarding that. With Zika, it was more rapid in spreading. What will be your opinion that with Oropouche?
So, I think Zika have competition with other flaviviruses in Brazil. We have more than 15 viruses that are circulating sporadically. So, I think it's a challenge. And also, when we have the outbreak in Brazil, rapidly all the country was infected. And later on, we cannot detect. Since 2015, from now, we have just few cases that are detected, and we are doing our work in Brazil. So the Zika is in our kit for diagnosis and spread all the country. So we can say for sure that Zika is not case in an outbreak in Brazil since 2015. But Oropouche is totally different. Because when we observed the cases in Amazon, we knew that the case are explosive case. Because in Evandro Chagas Institute, we can perform both the molecular and serological test in the patients, and like 2 or 5% of the cases are positive for molecular tools. Most of them are serological tools. And we didn't decentralization the serological tools for whole country. Just to make an idea, when we performed the investigation in the Northeast, just in one small city, when I was investigating the fetal loss, the first fetal loss case, we collected 50 samples for the population in this small city. 42 was positive by serology. To see how can be big, and is much bigger than what we have been seeing for Oropouche. And you totally agree with you. The moment that we started to look at Oropouche and started to looking for and test the samples, probably going to see the Oropouche has been case problem in our public health in many parts of the world for a long time.
The floor is open. Si vous avez des questions,
Yeah. Thank you very much, Daniele, for this very, very, very interesting presentation you made, and happy to collaborate after the symposium we had in Belém. With your long history of experience with arboviroses, but especially with Oropouche, to your knowledge, what are the top research priorities to conduct on Oropouche at that time?
When we think to surveillance, we need to develop and implement the serological test. This is our goal for yesterday. We need to do this work. But when we think about the basic announcement, we need to understand all the pathogenesis behind the fetus case. like I said, we suspected in the past, but was very difficult to prove because of the conditions in Amazon. It's very hard to investigate the case in Amazon. But in the moment that we detected the suspicious case outside the Amazon region, we are able to fastly go and prove what have been suspect for a long time. But we need to understand better, for sure.
And is there any cohort of patients in Brazil nowadays?
So I think we have two different cohorts that we need to study. One has to be done now. So every single positive case that we have with good CT has been sequenced. And we are understanding better the diversity of Oropouche based on this outbreak. But we also have our arbovirus collection, and we have 600 isolation from different point time in this history, from outbreaks of Oropouche that need to understand, because they need to understand the history behind.
Thank you.
And I hope that you guys can help us to do this work.
You convinced at least one people to look for Oropouche. That's me. In our cases, that we have no etiology in patients with the profile that you mentioned. So definitely we should think about it in cases where we have no etiology.